everyone, introduce myself. My name is Elsaday Kantu, or you can also call Elsa. I am currently in the 5th semester with student ID numbers 191401073 at the Indonesian Development University Manado. At this time, I will make an assignment about health problems. We are English course and a lecturer named Nurhayati with a Bachelor of Education, Master of Humanities. Health problems here I take about HIV/AIDS. Understanding HIV and AIDS. HIV or human immunodeficiency virus is a virus that attacks the immune system, which further increases the body's ability to fight disease. Drugs or methods of treating HIV have not been found. With certain medications, people with HIV can slow down the progression of the disease. So, people with HIV can live a normal. AIDS or acquired immune deficiency syndrome is a condition in which HIV is in the final stage of infection. When a person has AIDS, the body no longer has the ability to fight off the infection it causes. HIV and AIDS risk factors. Groups of people who are more at risk of infection include people who have unprotected sex, both same-sex and heterosexual relationship, people who often do tattoos or piercing, people with other sexually transmitted diseases, injecting drug users, people who have sex with injecting drug users. Causes of HIV and AIDS. In Indonesia, the spread and transmission of HIV is mostly caused through unsafe sex and taking turns using unsterilized syringes when using drugs. A person infected with HIV can pass it on the others even weeks after contraction it. Everyone is at risk of becoming infected with HIV. Symptoms of HIV and AIDS. The first stage, patients will experience pain similar to the flu. A few weeks after infection, for 1 to 2 months, may not cause any symptoms for several years. Fever, sore throat, raised, swollen lymph nodes, diarrhea, fatigue, muscle and joint pain may occur. Second stage. Generally, it does not cause further symptoms for years. The virus continues to spread and damage the immune system. It is possible for the patient to transmit the infection to other people, last up to 5-10 years or more. Third page. The patient's resistance is vulnerable, so it is easy to get sick and will continue to be AIDS. Persistent fever for more than 10 days. Feeling tired all the time. It's hard to breathe. Diarrhea that is severe and over a long period of time. A yeast infection occurs in the throat, mouth, and vagina. Purple spots appear on the skin that won't go away. Loss of appetite resulting in drastic weight loss. Diagnosing HIV and AIDS. An HIV test must be done to make sure a person has HIV or not. The examination carried out as a diagnostic step is to take a sample of the patient's blood or urine to be studied in the laboratory. Tips of tests to detect HIV. Among others, antibody test. This test aims to detect antibodies produced by the body to fight HIV infection. Although accurate, it can take 3 to 12 weeks for the number of antibodies in the body to be high enough to be detected during an examination. Antigen test. The antigen test aims to detect a protein that is part of the HIV virus, namely 24. The antigen test can be done 2 to 6 weeks after the person is suspected of being infected with HIV. If the screening shows the person is infected with HIV or HIV positive, the person needs to undergo further tests to confirm the results of the screening. Health doctors know the state of the infection and determine the appropriate treatment method. This test is done by taking a sample of the patient's blood for further investigation in the laboratory. These tests include count for CD cells. CD4 is part of the red blood cells that are destroyed by HIV. A normal CD4 count is in the range of 500 to 1,400 cells per cubic millimeter of blood. It occurs when the CD count is below 200 cells per cubic millimeter of blood. Viral load HIV RNA test aims to count RNA, the part of the HIV virus that functions to reproduce itself. The amount of RNA that has more than 100,000 copies per milliliter of blood indicates that HIV infection has just occurred or is not being treated. While the amount of RNA, which is below 10,000 copies per milliliter of blood, indicates that the development of the virus is not too fast, but damage to the immune system still occurs. Resistance test immune is done to determine what kind of anti-HIV drug is right for the sufferer. This is because some sufferers have resistance to certain drugs.
我真的睡着了。
HIV and AIDS treatment. Although until now, there is no cure for HIV, but there are types of drugs that can slow the progression of the virus. This type of drug is called antiretroviral ARV. ARVs work by eliminating the elements needed by the HIV virus to reproduce and preventing the HIV virus from destroying the CD4 cells. There are various types of ARV drugs, including etravirine, efavirenz, tamifluline, pseudoephedrine, and also nevirapine, while taking antiretroviral drugs. The doctor will monitor the number of virus and CD4 to assess the patient's response to treatment. A first CD cell count will be performed every 3 to 6 months. Meanwhile, HIV RNA examination was carried out since the beginning of treatment, then continued every 3 to 4 months during the treatment period. In order for the development of the virus to be controlled, people with HIV must immediately take ARVs as soon as they are diagnosed with HIV. The risk of people living with HIV to get AIDS will be even greater if treatment is delayed, because the virus will damage the immune system. In addition, it is important for people with ARVs to take ARVC according to the doctor's instruction. Consumption of drugs that are missed will make the HIV virus grow faster and the condition of the sufferer quickly. Take medication immediately if you are taking medication for the sufferer and keep following the next schedule. However, if the missed dose is quite a lot, immediately consult a doctor. The patient's condition also affects the appropriate prescription of dosage. Doctors can also replace it according to the patient's condition. In addition, sufferers are also aware to take more than one ARV drug in a day. Prevention of HIV and AIDS. There are various efforts that can be done to prevent the transmission of HIV and AIDS, including use a new condom every time you have sex, both vagina and anal intercourse. Have sex with more than one partner. Be honest with your partner if you are HIV positive, so that your partner also gets tested for HIV. Discuss with your doctor if you are diagnosed as HIV positive about further treatment and planning for delivery to prevent mother-to-child transmission. Circumcision to reduce HIV infection. If you suspect that you have recently been infected or contracted the HIV virus, such as after having sex with someone with HIV. You should immediately see a doctor in order to get a post-exposure prophylaxis (PAP) drug that is taken for 28 days and consists of 3 antiretroviral drugs. When they go to the doctor, if you are a family member experience the symptoms above, immediately consult a doctor for advice and appropriate treatment. Thank you. Teman-teman, yuk mari bergabung bersama kami di Universitas Pembangunan Indonesia yang di dalamnya ada ilmu keperawatan, fakultas keperawatan, profesi nurse, ilmu hukum, teknik elektro, fakultas teknik, teknik sipil, fakultas teknik, ilmu politik, fakultas sosial dan politik, agribisnis, fakultas pertanian, dan sastra Inggris, fakultas sastra. Yuk bergabung bersama kami di Universitas Pembangunan Indonesia di Manado.